Today, we're diving into a medical detective story. It's a tale that starts with something pretty common and honestly pretty scary, finding a lump in your neck. I mean, think about it. That's a discovery that would make anyone's heart skip a beat. But for a doctor, this is where the investigation begins. It's a careful process of gathering clues, crossing suspects off the list, and just following the evidence wherever it leads. So let's see how they do it. We're going to follow two totally separate patients. Both of them walk into the doctor's office with the exact same problem, a lump on the side of their neck. But as you're about to see, the journey they take and where they end up couldn't be more different. Okay, let's meet our first patient. For this case, it's all about the little details that pop up during that first physical exam. So what clues are we working with here? Our first patient, a middle-aged guy, has got several lumps. They're pretty big, they feel hard, and they don't hurt when you press on them. They're also what doctors call fixed, which means they don't really move around under the skin. They feel anchored down. But here's the kicker, the real clue. There are smaller lumps on the other side of his neck too. Having them on both sides, that's a huge red flag for a doctor. You know, a good physical exam is just as much about figuring out what something isn't. For instance, the doctor checks if the lump gets bigger when the patient, say, holds their breath and bears down. It doesn't. That simple test helps rule out something like a vascular problem, an issue with a blood vessel. See? Every test, even when it's negative, helps narrow down the possibilities. And then, boom, a breakthrough. Using a tiny mirror to look at the very back of the throat, way up behind the nose, the doctor sees something, a suspicious mass in an area called the nasopharynx. And just like that, the whole investigation pivots. The lumps in the neck, they're probably not the real crime scene anymore. They're just clues pointing to a problem that started somewhere else entirely. All right, now let's look at case 2. And at first glance, you might think, wait a second, this looks exactly the same. Our second patient is an older gentleman, and his lump is almost identical. It's large, firm, doesn't hurt, and it's fixed in place. The size is even the same as the biggest one from our first case. But here is the single, most important difference. It's just one lump, a solitary swelling. There are no others to be found. And that one tiny detail, it's going to send this investigation down a totally different road. So let's just pause on that for a second. We've got two patients with lumps that feel the same, are the same size, and are in roughly the same place. It would be so easy to assume they have the same problem. But medicine is a science of specifics, right? And one little observation that's different can change the entire game. And here it is, the game changer for case 2. While looking down the throat, the doctor notices saliva just pooling up in a little pocket on the side of the voice box. That's not supposed to happen. It's a sign that something, probably a growth, is creating a blockage further down in the throat. With that single observation, the focus of this investigation completely shifts, pointing to a totally different source for that lump in the neck. So with these first clues in hand, the investigation moves from the exam room to the lab. Now it's time for the doctors to bring out their high-tech toolkit to confirm what they suspect. One of the very first and most important steps is something called an FNA. It sounds super complicated, right? Fine needle aspiration cytology. But the idea is actually really simple. You use a very, very thin needle to pull out a tiny sample of cells from the lump so you can look at them under a microscope. It's a pretty low-key way to get a direct look at what's happening on a cellular level. And the process itself is really straightforward. First, you find the lump, then the fine needle goes in, a syringe is used to gently suck out a small sample of cells. And finally, those cells are put onto a glass slide for a pathologist to analyze. This one test can often tell you the fundamental nature of the lump, including whether or not it's cancerous. But an FNAC is just one piece of a much bigger puzzle. Doctors also need things like CT scans to see the full size of the mass and how it's connected to everything around it. They'll use an endoscope, that's a tiny camera on a thin tube, to get a really clear close-up look at those suspicious spots they found in the throat. And of course, they'll check the chest to see if the problem has started to spread. Okay, the lab results are in, the scans have been reviewed. Now it's time to put all of these clues together and finally crack the case for each of our patients. And here is where those two paths split for good. For case 1, all the clues, the mass high up in the throat, the lumps on both sides of the neck, they all point to a cancer in the nasopharynx that has spread. For case 2, that pooling saliva and the single lump point to a cancer that started lower down in the hypopharynx. Two very different origins, telling two very different stories. Now this is really cool. What you're seeing here is the doctor's list of suspects, or what they call differential diagnosis. You'll notice that some of the same suspects are on those lists, like lymphoma or even tuberculosis. But the prime suspect, the one right at the top of each list, is completely different for each patient. And it's all because of those subtle little clues they found right at the beginning. So why does all this matter so much? I mean, why is it so critical to follow these tiny clues? Well, because getting the diagnosis right means the difference between two completely different battle plans. And the stakes here are incredibly high. For case 1, with the suspected cancer from the nasopharynx, the main treatment is going to be radiotherapy. For case 2, with the suspected cancer from lower in the throat, the standard approach is major surgery to remove the lymph nodes in the neck. Think about that. The exact same starting symptom, a lump, leads to two profoundly different treatments, radiation versus the scalpel. And that's really the key takeaway here. A physical symptom, like a lump, is never just a random fact. It's the first clue. It's the opening chapter in an investigation. When you combine it with all the other evidence, it tells a very specific story about what's going on inside the body. And getting that story right, well, that's the art and the science of medicine. And that just leaves us with one final thought, doesn't it? This whole incredible journey started with something as simple as a lump. It really makes you wonder, what other seemingly straightforward symptoms, a nagging cough, a persistent headache, are actually just the first chapter in their own complex medical detective story?